Ever wondered what a doctor's bag looked like 100 years ago? Let me tell you, it's not what you'd expect. From tools that look like they belong in a horror movie to treatments that seem totally bizarre, the history of medicine is a wild ride. Stick around, because you won't believe what they once considered cutting edge. Number 7, in particular, will absolutely shock you. First up, let's talk about headaches. Got a migraine? Back in ancient times, the solution might have been a trepanation drill. That's right, doctors would literally bore a hole into a person's skull. The idea was to release evil spirits or relieve pressure on the brain. They'd use a hand-crank drill called a trephine. While it sounds terrifying, archaeological evidence shows that many people actually survived this procedure, and their skulls even healed. It was one of the earliest forms of surgery, and it makes you really appreciate modern medicine, doesn't it? Talk about a high-stakes cure for a headache. Next, let's slither into our second topic, leeches. Before we had sophisticated blood tests and treatments, doctors believed that many illnesses were caused by an imbalance of humors in the body, one of which was blood. The cure? Bloodletting. And the most popular tool for the job was the medicinal leech. Doctors would keep these little bloodsuckers in ornate ceramic leech jars, ready to be applied to a patient. The leeches would latch on and drink their fill, supposedly restoring balance. These jars were a staple in any 19th century apothecary. It might seem gross now, but for a long time, leeches were considered a vital medical tool. Got a toothache? You better hope your dentist didn't pull out the tooth key. This alarming instrument, popular in the 18th and 19th centuries, looked more like a vintage door key than a dental tool. It had a claw at the end that would be placed over the troublesome tooth. Then with a firm grip and a swift turn of the handle, the dentist would literally yank the tooth out sideways. There was no anesthetic, and the risk of breaking the jaw was incredibly high. It was a brutal but effective way to deal with a rotten tooth. It really makes you appreciate today's gentle dentistry, right? Before doctors had those familiar stethoscopes we see today, how did they listen to a patient's heart and lungs? Well, in the early 1800s, a French physician named René Laennec invented the very first stethoscope, and it was basically a wooden tube. He was uncomfortable placing his ear directly on a female patient's chest, so he rolled up a piece of paper, and voila, he realized it amplified the sounds. This led to the creation of the Monroe stethoscope, a simple hollow tube made of wood. Doctors would press one end to the patient's chest and the other to their ear. It was a revolutionary invention that allowed for more accurate diagnosis without direct physical contact. Okay, time for a quick break. If you're finding this journey into medical history as fascinating as I am, do me a quick favor. Hit that like button, subscribe to the channel, and ring that notification bell so you don't miss our next deep dive. Sharing with a friend who loves weird history would also be amazing. All right, back to it. Let's talk about something that was once a staple in every household, the mercury thermometer. We all know mercury is toxic, but for decades, it was the go-to substance for measuring temperature. What is truly strange is that doctors sometimes use them internally to take a patient's temperature. Imagine a glass tube filled with a toxic heavy metal being used in such a delicate way. Breakage was a constant risk, potentially exposing patients to mercury poisoning. It is a stark reminder of how our understanding of safety and materials has evolved dramatically over the years. Imagine needing an amputation in the 18th century. Now imagine it without any anesthesia. Surgeons relied on speed, and their primary tool was the surgical saw. These weren't delicate instruments. They were often large, intimidating saws that looked like something you'd find in a carpenter's workshop. The goal was to remove the limb as quickly as possible to minimize pain and blood loss. Surgeons were judged by how fast they could perform an amputation, sometimes taking less than a minute. While it saved lives from gangrene and severe injuries, the procedure itself was unimaginably traumatic and brutal for the patient. And now for number 7, the one I promised would shock you. In the early 20th century, a newly discovered element was marketed as a miracle cure-all, radium. This radioactive substance was infused into everything from water and cosmetics to chocolate and medical devices. One of the strangest was the radiendochrinator, a device containing radium that men were instructed to place in their underwear overnight. It was believed to cure impotence and boost vitality. People had no idea they were exposing themselves to deadly radiation. It is a terrifying example of how a lack of scientific understanding can turn a miracle cure into a deadly poison. Next, we have a machine that was both a lifesaver and a prison, the iron lung. During the polio epidemics of the mid-20th century, the virus could paralyze the muscles that control breathing. The iron lung was a massive metal cylinder that encased the patient's entire body, except for their head. It worked by changing the pressure inside the tank, mechanically forcing air into and out of the patient's lungs. For thousands, it was the only thing keeping them alive. Patients could spend weeks, months, or even their entire lives inside these machines. It stands as a powerful symbol of the fight against polio. When someone lost a limb in the past, the options for replacement were rudimentary. Early prosthetics were a far cry from the high-tech devices we have today. They were often crafted from wood, leather, and metal. A peg leg is a classic example, but craftsmen also tried to create more functional hands with basic hinges for fingers. These prosthetics were heavy, uncomfortable, and offered very limited mobility. They were more for cosmetic purposes or basic support than for true function. Still, they represented a critical first step in the journey to help people regain a sense of normalcy after losing a limb. Finally, let's look at a groundbreaking invention with a dangerous side effect, the X-ray machine. When Wilhelm Röntgen discovered X-rays in 1895, it revolutionized medicine overnight. For the first time, doctors could see inside the human body without cutting it open. However, in the early days, nobody understood the dangers of radiation. Both patients and operators were exposed to massive, unregulated doses. Shoe stores even had X-ray machines to check if shoes fit properly. This led to severe radiation burns, hair loss, and an increased risk of cancer. It was a powerful tool, but it came with a hidden deadly cost. And that's a wrap on 10 of the strangest tools from medical history. It's incredible to see how far we've come. If you enjoyed this trip back in time, please give this video a thumbs up, subscribe, and share it with your friends. Let me know in the comments which tool you found the most bizarre. Thanks for watching, and I'll see you in the next video.